Broadcast is now starting. All attendees are in listen-only mode.
Good morning. Welcome to the introduction to 2020 Oregon HPV Vaccination Week. Thanks for joining us today. Let's go over troubleshooting. During the presentation, all participant microphones will be muted. We will answer questions at the end. Type them anytime in the question box. The question box is in your GoToWebinar control panel towards the bottom. We will email you a copy of the presentation tomorrow, but you can download it today from the handout section on the GoToWebinar control panel. If you have any question, email me at carmenb@samhealth.org. Write down my email address, carmenb@samhealth.org. If you are experiencing audio difficulties, make sure your computer speaker volume is turned up or use the phone option to listen in. After the webinar, to help us provide best future training events, take a moment to complete the survey that will appear at the end. To obtain CME for this activity, at the end, you must log into www.eeds.com and enter the activity code that you will see on the next slide. We will email you the instructions tomorrow, but you must write down the activity code. Feel free to reach out to me or our office if you have any questions or concerns. We will be happy to be of assistance. Please write down this activity code to be able to obtain your CE or CME credit. Jenica Palmer, Carmen Boone, and the planners of this activity report that we have no conflicts of interest or relevant financial relationships with any commercial entities that might affect the contents of this presentation. Now, without further ado, let's start with the webinar.
Great, thank you, Carmen. Can you hear me okay?
Yes, perfect.
Okay. Well, welcome everyone. Thank you so much for being here today. This webinar is presented to you on behalf of the American Cancer Society, the Oregon Pacific Area Health and Education Center, and Oregon's newly established coalition, the Oregon HPV Prevention Alliance. This is the introduction to the 2020 Oregon HPV Vaccination Week. You may be aware that there was a 2019 vaccination week. That was Oregon's first ever vaccination week, and it was so successful that even during COVID, we wanted to offer a 2020 vaccination week. So this webinar is really designed to help you, all of our HPV vaccination week partners, have a better understanding of what vaccination week is and how you can be involved. So as Carmen mentioned, this presentation is being delivered by myself. I'm Jenica Palmer. I'm the Cancer Control Strategic Partnerships Manager with the American Cancer Society. And Carmen is, I'm the Education Coordinator from the Oregon Pacific Area Health and Education Center. The goals of this webinar. So what are we really trying to achieve today? Well, we have 5 main goals that Carmen and I are dividing and are going to be going over with you. They are listed here. So the first goal is to understand the goals and the mission of Oregon HPV Vaccination Week. And then, of course, looking at data, a caveat or a disclaimer, we don't have maybe the most up-to-date data, but we have numbers that I think tell us a significant story and all of the work we still have ahead of ourselves to increase HPV vaccination rates in our states, in our county, in our local communities, etc. So one of the goals that I'll be going over is looking at some messaging and some numbers around HPV vaccination data in Oregon. The third goal is around accessing and understanding the different tools and resources that are out there. There's so many. The toolkits and the website and all these other wonderful things are just a few of them, but we'll be going over that in more detail as well. Fourth goal is to strategize participation. So you're interested, what is it? What does it look like? What can you do? How can you be involved? And then part of this campaign, this vaccination week, and all of the things that we're working on collectively are to raise awareness on the importance of HPV vaccinations and how that they are cancer prevention, and we really want to increase rates in every community. The next slide, before we dive into the goals a little bit more, we wanted to make sure you are actually aware that there is a website. It was created last year in preparation for Oregon's first vaccination week. It's an amazing website. has a lot of resources. It's constantly being updated and monitored, but you can kind of see that's the screenshot right there. There's tabs for providers and for parents. There's just a general resources tab and a Spanish tab, and we added a COVID-19 tab. Not necessarily COVID-19 and the HPV vaccination, but just resources around COVID-19. So you can, the website is www.oregonhpvcancerfree.org. You can access all of that stuff by going there. The other resource that's part of the website is, of course, the Vaccination Week Toolkit. That's at the top of the page. You can download that. It's a PDF document, and it really outlines some other key strategies or evidence-based interventions that you can implement now during vaccination week and beyond. And one thing I want to dive home on is that this whole campaign, this vaccination week campaign, the idea behind it is that it's a two-pronged approach, right? We are campaigning, we are promoting, we are increasing awareness. We have a website, we have resources, we're spreading the word HPV vaccination is cancer prevention. That's one prong. The other prong is engaging health systems throughout the state, all different types, FQHCs, primary care, hospitals, health plans, whoever out there can do something to engage with them and to look at implementing interventions and doing work specifically within their health system to improve workflow or rates or what have you, as far as the HPV vaccine is concerned. So that is that. This is a lot of this is going to be just us presenting to you, and we hope at the end there will be time to have discussion, have Q&A and whatnot, like Carmen mentioned. So those are our goals. These are some key resources, and I'm going to turn it over to Carmen. She's going to do goal 1, and then I'll do goals 2 and 3, and she'll do goals 4 and 5. So she'll kick us off with goal 1. Go ahead, Carmen.
Thank you. So our first goal is diving into Oregon HPV Vaccination Week, its vision and its reason. In short, we have a collective goal and role for everyone, eliminating HPV cancers, which can bring people together on a national, state, and local level. Who doesn't want to prevent cancer? This work starts with each of us. Oregon HPV Cancer-Free is calling you to action in the fight against human papillomavirus, which is a group of viruses linked to 6 types of cancer and other diseases. We're asking you to join us in the fight against HPV starting today by improving HPV vaccination rates in Oregon. We invite your organization to participate in our 2020 Oregon HPV Vaccination Week, which is from August 15 to 22nd. If you're marking your calendar right now, you might know that there are 2 Saturdays in this week. This was strategically planned to help reduce barriers for patients and parents. It is our hope that some of our partners might expand weekend hours to decrease barriers for working parents. The main goal of the vaccination week is to help prevent HPV cancers and pre-cancers through education and community engagement. By instituting system changes to improve HPV vaccination, your system or organization can improve HPV vaccination rates and reduce future suffering, lower costs associated with treatment, and ultimately help save patients' lives. When this idea was proposed, the goal was simple. We were excited to see many partners involved. I'm going to read our goal to you and really highlight the pieces that speak to us. The goal of the Oregon HPV Vaccination Week is to reduce the number of HPV-associated cancers by supporting improved vaccine uptake among adolescents in Oregon through education and collaboration. Together, we will reduce the number of HPV cancers. We will improve vaccination rates. All of these will be done through education and collaboration. We cannot do this work alone. It is critical that key partners are engaged in this work. And today you're here Today you showed up to learn. Thank you for joining us in our Oregon HPV cancer-free campaign. By working together, this will have a lasting impact. How exciting it is to think you will be part of creating a generation free from vaccine-preventable cancers. We know that each region, community, and jurisdiction has its own set of challenges, opportunities, and systems to tackle to improve HPV vaccination rates. Regardless of which educational or collaborative initiative you take, we're delighted to have you as an official or potential partner. Oregon HPV Vaccination Week has two key audiences to reach: parents of adolescent boys and girls in Oregon, with a special focus on rural communities, and providers seeing adolescent patients and working to make a strong and effective HPV vaccination recommendation. Why are we targeting these two groups? Because increased parent knowledge will reduce confusion and increase HPV vaccination. And because HPV vaccination is cancer prevention. This is the key message. HPV vaccination is cancer prevention. It's the number one message. Communicating this message will help create a generation free of HPV cancers. It's key to strengthen provider recommendations. And the biggest predictor of HPV vaccination uptake is an effective recommendation from a healthcare professional, specifically a family medicine or pediatric professional. So I can assume that you joining this call, this webinar, means that you are interested in engaging in this work. If you are committed to the vision of Oregon HPV cancer-free, we consider you a partner in 2020 Oregon HPV Vaccination Week. On the website, there is a page for campaign partners. When you become a partner, you show support to American Cancer Society, Oregon Pacific Area Health Education Center, and the Oregon State Immunization Program for the Oregon HPV Vaccination Week. You inform others that you're working on increasing HPV vaccination rates and state that you are a local resource for any community members that may come across the site. If you would like to be highlighted on this page, please go to www.oregonhpvcancerfree.org, download the pledge that you'll see at the top of the homepage, and send me your signed file at carmenb@samhealth.org. We'll dive in deeper in future slides about expectations of our partners during HPV Vaccination Week.
Great.
Yes,
Thank
now
you,
I'll leave
Carmen.
you with Jenica.
Yeah. So I will just briefly go over goal 2. As mentioned before, it's to really look at your data. We're not going to talk about how to necessarily analyze it, but to just be aware of your data, your health system data, your community data, your county data, your state data. So analyze it and understand it and what it's saying around the HPV vaccination and HPV cancers in Oregon. You might be aware that we get all of our data, most of our data, from the electronic health record and or the alert system. And our amazing partners at the Oregon Immunization Program are the ones looking at that data, analyzing that data. They are incredible and really they're very busy with COVID-19 response. But if you have a data question, we can help answer it or connect you to them if you aren't connected with them already. So, and the other, one key point is you want to know where you're at so you can know where you want to go, right? So data tells a story. It helps us target certain groups, certain communities, certain geographical areas. So we really use that data to help drive our strategy. locally or at the state level for how we want to move forward with trying to increase rates. And you also might be aware on the next slide that the HPV vaccine can prevent up to 6 different types of HPV-associated cancers. That's your cervical, your vulva, vagina, anus, your oral cancers like the tongue and the throat. And then also the vaccine prevents against HPV types that can cause genital warts in both boys and girls, or men and women. Right now, what we have, or what's presented on this slide, if we go to the next slide, is that our up-to-date rate as of 2018, it looks like, from the Oregon Health Authority's data is around 51%. And we know this number fluctuates, it decreases, it increases. So we can always contact our state partners and ask for the most up-to-date, but when this presentation was put together and edited for a talk that we gave earlier, a couple months ago, I think, or last month, the rate was 51% from 2018 up to date. We know COVID has significantly plummeted all immunization rates, including the HPV vaccination rate, just because prevention and administering immunizations really took a back seat to COVID. So this number will look dramatically different moving forward and next year, but before COVID, this was a rate that we had in our state. I'm going to very quickly go over the next few slides. It's really just about messaging. So these are some key messages. All of your state partners, the HPV Prevention Alliance, all of the leadership teams and everyone, and ACS and beyond really want to hit home. We really want to drive home these messages. You will constantly hear the American Cancer Society talk about the HPV vaccination as cancer prevention. That's it, prevents cancer. That's what we're here to do, is prevent HPV-associated cancers. So message number 1, HPV vaccination is cancer prevention. Message number 2 is on the next slide. The vaccine, the HPV vaccine, is safe and it is effective. It is safe and effective. This vaccine and all other vaccines are constantly monitored. If there is a question related to safety or effectiveness, they dive deep into it, they research it, they review it, and they come out with evidence-based peer-reviewed studies to talk about it. And right now, up to date, and as we anticipate the future will say, this vaccine is safe and effective. And there's a lot of other resources out there that can help with messaging. I do want to plug the HPV virtual summits coming up on August 19th and 20th, and there's a specific presentation during that virtual summit around messaging and communication. So if you don't have that information, please follow up with Carmen or myself, and we'll happily send you information to the summit. Again, August 19th and 20th. The next slide, another message. As you might be aware, this vaccine didn't target boys when it was first rolled out, but my goodness, it does, and we want to hit home that this vaccine is for both boys and girls. So just to be assured that that is in fact true, and that is what we're encouraging all healthcare providers to message out and our community partners to message out, that this is for boys and for girls. Okay, and on this next slide, it talks about how the vaccine is best given, or that works the most or is most effective if given between the ages of 11 and 12. I do want to say we didn't update this slide yet, but the American Cancer Society came out with new messaging because we were saying between ages 11 and 12 or as early as 9, right? And to simplify that messaging, really based on message testing and the latest science, we have updated our messaging to say we recommend this vaccine between the ages of 9 and 12. So we've just kind of lowered it down to 9, and instead of saying or as early as 9. So just to be aware of that it is safe, and that's because the cohort, the study of the pilots that happened when this vaccine was being tested was done on children at 9 and no younger. So there's no evidence younger than 9, but we do know that it is safe at 9 because that's the age group that it was originally tested on. So you can feel confident in saying that this vaccine is recommended between the ages of 9 and 12 for the most effective outcome. because the immune system has such a better response during those years. Okay, and this next slide is really just an FYI. If you haven't seen it, this is Oregon. This is our by-county data from 2019. It says up there 2019 HPV completion rates between ages 13 and 17 years old. So you can kind of get a breakdown there, what counties have higher rates or some have some lower rates, and really understand kind of where the state of Oregon is around completion and the HPV vaccination. There's also amazing PDF links to data from the past 3 years, or 2016, 2017, 2018, that you can compare that data and see the changes that have occurred over those years. And then the next slide is around, again, this idea of knowing your data. What is your data? You have to know it so you can think about how you can improve it, right? One amazing resource is this report card. This came out from the American Cancer Society's HPV Vax team. We have several resources that kind of mimic this, and I know the states and the ICPIT, or it used to be AFIX program, also has resources that really the idea behind these resources is to review your data, right? Understand where you're at, identify different gaps or barriers, and then get your baseline, like where you currently are at, and then set a goal. How, like over the course of 6 to 12 months, how much do you want to increase your vaccination rates by? 1%, 5%, what is that goal? You set that goal, and then to achieve that goal, you work with your system, your quality improvement team, your community partners, such as us, to implement evidence-based interventions. And we're going to go into some examples of what evidence-based interventions you can implement are to help you achieve that goal that you set. So this report card is one example, and there's other quality improvement tools out there that are also available. So if you don't know where to start and you really want to get to know your data better, please, again, reach out to us and we will be able to help you. These are the 3 simple steps, right, by knowing your data. So setting goals for improving your rates, educate primary care physicians on their vaccination rates, and then monitor your progress. It's sort of like the checklist of what you can do. This next slide, I'm just gonna, it's there. I don't think I need to read it off, but these are just some facts on the vaccine and the virus. It's a really well laid out slide. It was put together by our late colleague Laura Brown, and I think it's a nice visual for you and to share out to other folks when you're talking about the vaccine and different facts and figures about it. Okay, so now I'm going to go into goal 3. Goal 3 is to strategize participation in Oregon's HPV vaccination week and beyond. So what does that mean? How do you do that? Or what is this vaccination week, right? Well, there's 3 phases to it. Carmen talked about signing the pledge to be an official partner. We have a hashtag Oregon HPV Cancer Free. We have the website. So just if you don't sign the pledge, you know, just still committing to doing something is really what we're hoping folks to do. And we saw this from other studies and other campaigns in other states. This model really came from Idaho when they targeted an approach and they had people sign on to target the approach together. They saw an increase in vaccination rates over time. So in Idaho, it started out as a vaccination day. That was so successful, they had a vaccination week, which is how we modified this for Oregon. And then that was even so successful for them, so they have a vaccination month. And I think you're aware, but August is actually immunization month. So we're really happy to be offering this in alignment with immunization month. So sign the pledge, do something, offer to commit to supporting this goal. The second phase is to plan and execute at least one evidence-based intervention. And the third is to increase your system's HPV vaccination rates and overall reports. Okay, so this slide is just is information from the Oregon Health Authority. They published these great resources on strategies for increasing HPV vaccination rates. This is really just an FYI for you, something that we encourage you to check out. And now these are 4, there's more than 4 on the next slide, Carmen, 4 focused evidence-based interventions and resources that There's other ones out there, but these are ones that we've seen be effective for people to implement all of the time. But if you need something or you need an idea of what to implement during vaccination week, these are some examples. So professional CME or provider education, right? Client reminders, reducing structural barriers. So with that, we intentionally have vaccination week the 15th through the 22nd because that does have 2 Saturdays on there. So thinking about reducing structural barriers by offering something outside of the normal clinic hours. And then of course, clinical champions. Clinical champions are a huge way to support this work. The research behind engaging champions is just incredible. So we'll go into each one of those a little bit more specifically. Because our amazing partners at the AHEC drive so much provider education in our state, we partner with them all of the time, especially on the You Are the Key and other provider education opportunities. I'm going to turn it to Carmen so she can talk about this one, and then I'll go into the next 3. So Carmen, take us away with provider education.
Thanks, Jenica. So as Jenica was saying, the first strategy is to strengthen provider recommendations. So the biggest predictor of HPV vaccination uptake is an effective recommendation from a healthcare professional, specifically a family medicine or pediatric professional. Evidence shows that a clinician recommendation plays a critical role in getting parents to accept HPV vaccination for their child. Therefore, provider education means training providers and clinical staff on how to offer an effective recommendation for HPV vaccination to parents of adolescents. So, how do we educate providers and staff? That's easy. In the handouts from today, which I'll email you tomorrow just in case, you will find the provider education and You Are the Key CME training fact sheets. These documents highlight a great resource for provider education called You Are the Key to HPV Cancer Prevention. This training was developed by the CDC and Oregon Pacific AHEC to provide these trainings in all settings, and they take care of CMEs and evaluations. In a nutshell, you can contact us, Oregon Pacific Area Health Education Center, and coordinate a free You Are the Key CME training for one or more of your locations. The You Are the Key presentation offers up-to-date information on HPV infection and disease, the HPV vaccine recommendation, and ways to successfully communicate with patients and their parents about HPV vaccination. Any licensed professional can deliver the training. We typically engage MDs, OBGYNs, etc. Outside of You Are the Key, CDC has several resources for providers, including a dedicated website for healthcare professionals on HPV vaccine resources, a tip sheet for talking about the HPV vaccine with parents, and continuing education programs for pediatricians and family physicians regarding the clinical impact of persistent HPV infection and the importance of vaccinating adolescents at ages 11 to 12 or earlier. To provide public acceptance of HPV vaccination, CDC continues to use research data to create an evidence-based communication campaign to reach the target audiences. So I'm hoping you're taking notes to look at your calendars for scheduling. And if you have already hosted a You Are the Key, I encourage you to sharing comments about your experience. And as we stated in the beginning of this webinar, this is a collaborative training, and we're truly hoping to have HPV Vaccination Week be an opportunity for sharing best practices. If you want an HPV You Are the Key event, free CME event in your location, contact me and we'll get it done. And I'll hand you over now to Jenica.
Great, thanks, Carmen. So our next evidence-based intervention that you can implement during HPV vaccination week is around developing and or improving your client reminder system. Immunization reminders and recall systems are really cost-effective methods where, right, if the child or the adolescent or the patient is in need of that immunization or is in need of that HPV vaccination, this reminder will identify that need and contact that patient or the patient's parent to have them come to the physician's office, right? So that it's the touching point, a constant reminder that, hey, your child is due, let's get you scheduled, let's get you in. This one is so important really because research has showed, and just conversation really with our health systems partners that work with patients in this capacity, often report that parents don't know the vaccination status of their child. They might know that they got one, but they can't remember if they got the other or what have you. So having some type of system in place where you're communicating and having that sort of transparency with the patient is really key. And it can, it's really an important step too in understanding, but back to why data is so important, looking at your data. And if there is a discrepancy between, you know, your initiation or your completion rates, then that can also be an indicator of, you know, the importance of looking at a recall program. And then with the way that the parents often aren't aware that data, and sort of doing a recall or improving your reminder system can help clean up some of that data. Around this, because we know that data and reporting data can be really tricky and it can be confusing sometimes, or sometimes it doesn't get done. So just being aware of that and then looking at cleaning up your data and incorporating client reminders, I think is what we're seeing is an effective approach. And there are several methods that you can use to do client reminders, right? This slide outlines them all right here. It's, intervention options are a telephone reminder call, in-depth reminder call, short reminder call. You can do text messages, you can have auto, and like an auto message. So that's telephone based. You can also do mailed reminders such as letters or postcards. Some systems have patient health portals, etc. This snapshot of this resource is showing, you know, a way to implement pilots and trying to improve, or like I said, develop, if you don't have one, a reminder system by using the plan, do, study, act model, right? So if you don't know if it's going to work, you can plan an idea and follow those steps to implement it, and then study its effectiveness, and then act on either moving forward with that or modifying it for whatever barriers or gaps that you address during the rollout process. The next slide, these are just some reminder recall resources. So it can be overwhelming at first if you haven't done this or you don't know where to start. These are amazing links by the American Cancer Society, American Academy of Pediatrics, etc. So review those. We also have a really great steps guide at ACS that really lays out some specific steps you can take to increase vaccination rates in your practice. That's on the website. We have that, I think, listed a few places. So if you do need help getting access to that, please reach out. But hopefully that can give you some specific examples of how you can implement reminders or recall systems. So next is reducing structural barriers. I talked about earlier how this is an important one. There is research out there that shows that addressing barriers can be a really significant way to increase vaccine use in health systems and in communities. The next slide, I think, talks about, identified barriers to the vaccine. So what are some barriers? Often we hear that parents don't know enough, and that education is so important. So again, that messaging, that communication, developing that trust, and just providing more information to parents. Another barrier is the cost of the vaccine and vaccine accessibility. There's sometimes confusion around that and what insurance will cover. This idea that folks weren't aware at first that the vaccine is also for boys, so boys versus girls, or vice versa, or what have you, but that this vaccine is in fact for both. So we really saw numbers around vaccination initiation and completion for boys much, much lower at first, but that number is catching up, and we're really happy to see that it's catching up. So I think the messaging around how this is meant for boys is getting out there. And then, of course, following through and getting a series completion. That can go back to reporting or what have you, but just not just doing initiation, but following up with those reminders or tracking the data and making sure the patient comes back in to complete the series. So this shows, let's see, yeah, similar findings to earlier slides, I think, or yeah, just some other just data that you can see presented on parents of girls, parents of boys, and whether it was recommended or a lack of knowledge or folks they didn't think it was needed or necessary. Then you have data around safety concerns and side effects, and that parents aren't wanting to administer it because their child's not sexually active. So an interesting slide, an informative slide, really helps us understand the thought process and thinking of some of the patient's parents that are out there. So we can increase vaccinations several ways. These are three suggested ideas, is that, checking the status at every visit, of course, increasing education, as we're trying to hit home during this presentation, that education is key, trust is key, communication is key. And then around more training, not just education to parents, but training on providers and on effective messaging and messaging out a strong recommendation. And I think you've heard about the bundle approach and all of those different methods where you don't want to just give one shot at a visit and have a missed opportunity. You want to bundle the vaccine with maybe Tdap and meninge and offer the child all of the shots that they're due for at that one day. And then making sure that the next shot is scheduled before they leave the clinic. And the next slide. Oh, I was ahead of myself, but this is just hitting home the point I just mentioned about missed opportunities. Looks like this slide illustrates the impact of eliminating missed opportunities and what that impact could have on a patient population. So pretty significant that we want to try to eliminate those, and a lot of those are eliminated by, again, just having a plan in place, right? And following that plan and modifying the plan to address any gaps or barriers that you're having. Okay, back to education is key. I think we've hit this home. HPV vaccine is covered by most plans. So one of the barriers was folks were unsure about that we've heard, right? But in fact, it is covered by most plans, and there are local resources out there for reimbursement. So again, this is just connecting folks to partners or resources so they can help be better informed and make a decision. And we find that the decision to vaccinate does come more easily with the more education that we give. Okay, so I think this is the last one that we're talking about as far as implementing evidence-based interventions, and I talked about it briefly, but having a clinic champion. So this is really having an HPV vaccination champion who advocates for practice change. It's a really important component to initiating and having sustainability around increasing vaccination rates within your practice. Clinical champions are individuals that can serve like in a leadership role or be part of a leadership team, or maybe they're on the quality improvement team. When you're looking to identify a clinical champion, if you don't already have one, some key traits are, of course, to make sure that they're enthusiastic about the work, that they're passionate, that they bring a certain type of energy to this, and they could be an influencer of change. And talking about change, it is beneficial if the champion has authority to implement practice change or to advocate for the implementation of practice change. And then making sure that this is on the agenda, right? That this is actually something that is continued to be discussed at the different provider meetings or what have you, and that there are other workflows out there that you might already have where you can just tuck in some best practices for the HPV vaccine. So you're not reinventing the wheel, but really having a champion that understands that is really an effective approach. The next slide, a champion. So these are things a champion can do, right? Educate other healthcare professionals, discuss HPV vaccinations with parents, and make necessary changes in your practice. And we wanted to, highlight this toolkit on just HPV champions from the American Academy of Pediatrics. So if you haven't checked that out, didn't know it was a resource, we encourage you to do that. Clinical champions also are, there to prioritize the HPV vaccine as something important to implement or continue implementing or improving the implementation of in your practice. So ways that they can do that are around provider education, but actually scheduling one. We've done so many of these where we align a presentation during an already scheduled provider meeting. So we're not taking more time out of the staff, but we're aligning it with an already scheduled meeting. Or early in the morning or during the lunch hour. We've also closed down whole clinics. So the whole clinic and the administrative staff, all the way to the provider, everyone involved can have training. So that can look like a grand rounds or whatever type of training makes the most sense. If you don't have one or you need to add more people to it, form a quality improvement team or make sure there's voices at your quality improvement team that can advocate for the vaccine and implementing it to your workflows. More education, of course, and then identify external support. And hopefully it's hit home that we are your external support, and there's a lot of other external support out there, but the American Cancer Society and AHEC are here to continue supporting you during vaccination week and beyond. So Carmen's going to take us home with the next two goals, and then after that we'll have a few more slides and some Q&A. So Carmen, take us away.
Great, thank you. So how can we get the message across? Do you have to come up with your own communication plan? What is the message you should be using? Don't fear, we have tools designed for this work. First, here's where we are with available marketing resources. Ideas and thought starters you can use in your social media activation, share video PSA and tell stories of HPV cancer survivors in your area, videos from HPV cancer experts and survivors, host a Facebook Live interview or webinar with an oncologist or OBGYN to talk about HPV cancer prevention. Follow the American Cancer Society account on Facebook, Twitter, and Instagram and repost their content. Use the hashtag Oregon HPV Cancer Free on your social media. Share a fact about HPV cancer prevention or vaccination. Share why you are inspired by the Mission HPV Cancer Free campaign. And you can find resources on our website, www.oregonhpvcancerfree.org. Be sure to follow Oregon HPV Cancer Free on Facebook and like, comment, and share our content. Use hashtag Oregon HPV Cancer Free in your posts and reshare posts from the American Cancer Society and from the Oregon HPV Cancer Free Facebook pages and other partners. Social media posts have been created already. You'll note a few sample tweets or captions on this slide. That's just the tip of the iceberg. Check out the Power to Prevent Cancer content from the National HPV Vaccination Roundtable. And on the toolkit, you'll find these resources and the links to the web pages. There are two additional toolkits at your disposal. Immunization Social Media Toolkit from the American Academy of Pediatrics, and another toolkit available is by the National Vaccine Program Office. They have data and fact-specific graphics you can share. All of these links and resources are available on the Oregon HPV Vaccination Week Toolkit that you can get from our webpage. In addition, the American Academy of Pediatrics released a whole document within their Champion Toolkit for Facebook and Twitter posts. It offers language on HPV vaccine, vaccine safety, paying for HPV vaccine, cancer prevention specific content, and more. Again, you don't have to reinvent the wheel to make an impact in raising awareness during HPV vaccination week. Use what has been developed and help us educate communities and spread out the word. Now, our fifth goal and last one is very resource specific. From print materials to social media posts, partners can access ready-to-use materials, many of them co-brandable. The following tools and resources are available for you to use in our HPV vaccination efforts. Several resources are publicly available. Others can be accessed by reaching out to your ACS staff partner, or you can contact the AHEC too. If you are not already connected to an ACS staff partner, reach out after this webinar, and we'll be sharing the contact information for American Cancer Society and Oregon Pacific AHEC staff heavily engaged in this work. We believe that every healthcare professional plays an important role in increasing HPV vaccination rates. 6 clinician and system action guides were developed to encourage providers, support teams, and health systems to take action today. Get the go-to guide for healthcare professionals and systems to increase HPV vaccination rates specific to your practice or enterprise. This page is straight from the HPV vaccination toolkit, and each of the documents are linked to the resource. You can find the HPV Vaccination Week Pledge, the toolkit, and many more resources on our Oregon HPV Cancer-Free website. We also have most of the same resources available in Spanish, and as Jenica mentioned earlier, resources related to COVID-19 and vaccination. Be sure to visit our website and download the toolkit. Keep in mind that the toolkit is linked to each of these resources, and our site contains many more. Before we wrap up information on resources, I want to make reference to the Mission HPV Cancer-Free campaign launched by the Cancer Society in June of 2018. ACH launched this global public health campaign to increase HPV vaccination rates among boys and girls to 80% by 2026. As part of the mission, ACS has created a portfolio of resources that partners can use to educate and promote HPV vaccination. Oregon Pacific AHEC partnered with the American Cancer Society in 2019 and created the site OregonHPVCancerFree.org as the first of its kind in our state to serve as a HPV reference hub for Oregonians. So, the last resource I'm going to show you is the campaign resource guide. It's also in the handouts, and it'll show you why targeting HPV vaccination rates matters, how we can help you achieve your goals, and provide valuable tools and resources to make engagement and results easy. On the page that follow, you will find overviews on engaging in HPV vaccination work tailored to health system partners and coalition public health partners, background information on our Mission HPV Cancer-Free campaign, and resources for HPV vaccination work. So the big question is, what can we do right now? We have resources available for a variety of settings. Look at it and know it. Find what is relevant to your patient population. Spread the word. Post on social media, email your system or clinic, and let them know. Engage in our Oregon HPV Vaccination Week as an official partner. Who needs to be involved in this work? Everyone. everyone. Engage and educate your entire team. This is not just for the QI department. This is not for the community outreach staff. This is for everyone. Additional ways to engage: you can recognize providers that are doing well with vaccination rates and support orders to achieve similar success. You can work with your state and local immunization registry, coalition, academic, and other partners to better understand the vaccination rates in your community and perhaps barriers to even better data. Rally your quality improvement and other systems, staff, and leadership to implement evidence-based approaches to increase vaccination rates, including but not limited to standing orders or reminder recall systems. Support parent or survivor champions in your community who can assist you in spreading a vaccine-positive message to increase parental awareness. Now, on this slide, you can see the contact information for all the ones that are involved in this campaign. Feel free to contact anyone. We'll be glad to provide all the support you need. Now, I'll give it back to Jenica.
Oh, thanks, Carmen. Well, that really concludes our presentation to you all. So really, we want to thank you for all of the work that you're interested in doing or are currently doing or have been doing to reduce the number of HPV cancers and to increase the HPV vaccination in Oregon. So the American Cancer Society, the Oregon Pacific Area Health and Education Center are proud to deliver this, of course, also in partnership with our newly established, as I have mentioned, Oregon HPV Prevention Alliance. So if you're interested in joining the coalition or joining the alliance, let us know, because all of us are really proud to partner with you and hope to do more work with you during this week and beyond. So we have about 7 minutes until the top of the hour, and really there's no formal process for this, but we want to open it up to questions. Carmen, I don't know if there was anything typed in.
Let me check.
Okay, and feel free to come off mute and ask a question or a point of clarification or make a statement or whatever you'd like to do.
Yeah, let me see what questions we have. We have one question. It is from Lori Henning, and she's asking, missed opportunities goes to year 2000. Is there more current data available? I think she's talking about one of the slides that we showed.
Yeah, absolutely. There definitely is current data. We'll look into that and follow up with the participants of this webinar. I think that when these slides were created, that was really just to show what missed opportunities can, the data between them and how impactful they actually are, and what we can do, and talking about what we can do to not to decrease missing those opportunities. But you're right, it's a little outdated. So we'll look for new data. I know it's out there, and we'll follow up with you.
So we are not receiving any other questions. All right. So thank you, Jenica.
Okay. Anyone have anything else before we do hang up? We'll count to like 30 in our heads, but we really want to make sure that your questions are addressed. Okay, well, if you do have questions about the upcoming vaccination week or Oregon's HPV virtual summit or our HPV Prevention Alliance, which is our coalition, please reach out to us. We're happy to provide you with more information. We'd love your involvement in all of those things. I know that capacity is limited considering our current climate, but know that we're here, we'll be here, and we're happy to help. So thank you very much for your time today.
Thank you, Jenica.
Thanks, Carmen. Yeah, take care.
Thank you. And so before we are done, I want to express our thanks to Jenica for joining me and for joining all of us today. And I want to, before we go, tell you to please write down this activity code to be able to obtain your credit, your CME credit. To obtain the CME credit for this activity, log into www.eedsasindacSasInSam.com and enter the activity code. Feel free to reach out to me or our office if you have any questions or concerns. And finally, please complete the survey that will appear as soon as the webinar ends. And now you have completed the introduction to 2020 Oregon HPV Vaccination Week webinar, and you may disconnect. Have a wonderful day. Goodbye.